raise your hand. This is for mostly all of my females out there, but some of my males might be able to relate as well too. Raise your hand if you're a female between the ages of, I don't know, let's say 18 to 45, and you've been told by a medical professional at some point in time that your health issues are probably, just stress, or just you probably have anxiety, or without saying it, but kind of saying it, they're hinting at you're crazy and it's all in your head. Because I hear this type of story and this type of sentiment way, way, way too frequently in my practice. And I want to give us a little bit of a different perspective, especially on this world of where mental health and some of our neurological kind of based symptoms tend to converge. Because in a conventional medicine perspective, sometimes we get a little bit guilty of zooming in, right? We really want to zoom in, double click on what's going on in the brain, what's going on in the thoughts and the patterns, and taking the head off the body, tinker with it, and put it right back on the same body, and then shrug our shoulders and act confused of like why it doesn't stick or why it doesn't work, right? Because we understand that the neurological system connected to our nervous system, connected to our brain, like these things do not function in isolation, and they are very much part of a bigger structure of the human body and the human metabolism together. And so one of the perspectives that I really want to shift our focus to today is continuing this theme and this series around histamine spectrum conditions. Our neurological symptoms, especially things like migraines, anxiety, brain fog, insomnia. This is not just the head communicating to the body. This is very much the body also communicating to the brain. And more often than not, I'm seeing more and more individuals who are coming in getting mistreated and kind of misdiagnosed in this world of how the body is actually communicating a stress response to the nervous system that is impacting a lot of these neurological type symptoms. And a lot of these are coming from the gut, specifically how our gut houses our immune system. And our immune system produces these more inflammatory, very excitatory compounds called histamines. So if you joined us for our series last week, I talked about how a lot of the gut issues, especially around like bloating, IBS, food sensitivities, how often I'm seeing this like histamine misconnection, and nobody is seeing it until I start to kind of ask some of these deeper clues and deeper questions. They're just getting thrown like, you have IBS, here's some antispasmodics, or you just have food sensitivities, here's an elimination diet. And nobody is looking at and really zooming out about what is communicating to the gut to act and behave that way and to begin with. So it's more of an immune system driven gut symptomology versus just taking the gut out of the body, tinker with it, and put it right back in, right? And it's really no different when we start to look at how histamine spectrum conditions show up across other biological systems, especially our nervous system and some of our like maybe things that we associate a little bit more with the brain or associate a little bit more with like our mental health field. So the amount of individuals that I have seen that come into clinic that tell me they've been dealing with like anxiety that feels not just physical, or excuse me, it doesn't just feel just mental, it feels physical too. So the anxiety is accompanied by their heart feels like it just kind of, sometimes they can just kind of feel this like wave of panic that doesn't really seem connected. And this may also be the same person that's dealing with migraines, not just occasional headaches, but like reoccurring episodes that can take them out for hours or can even take them out for days at a time. And with these migraines, they even feel like sleep becomes unpredictable. They're the person that they're exhausted, but at the same time, they can't shut themselves off at night. They find themselves waking up between 2 and 4 a.m., like wide awake, or they fall asleep easily, but they wake up frequently and they feel like they wake up and their body's never really truly rested. And From there, usually these types of symptoms, whether it's, like I said, the headaches, the anxiety, the insomnia, they go to their primary care practitioner, who usually sends them off with some prescription SSRIs or anti-anxiety medications, maybe some beta blockers for the heart palpitations, maybe some sedatives for the sleep. And again, the pattern like shows up all over again, right? It's like it's not fixing the problem, because what we didn't look at is we were blaming the head and the nervous system for something that is very much more the body communicating to the brain that there's something to be stressed about. And very, very often this is correlated and connected to an underlying gut immune response that is sending some of these excitatory compounds to the brain, and is not just a mental health problem, but is actually very much a physical health problem that is manifesting as mental health symptoms. So I only say this because I think this like histamine conversation, I see it especially in my peri and menopausal females, because when estrogen and progesterone start to decline, those hormones are very immunoprotective. And this is the same reason why some women have quite a few health issues and then they get pregnant and they feel phenomenal. I'm like, that's progesterone, and progesterone actually put those like kind of immune dysregulation patterns that you were having, it put it in remission. It put it in dormancy while you were pregnant. And then all of a sudden when you're not pregnant anymore, like those like come back in action, right? And so what happens a lot of times in these like hormonal transitional periods for women, whether it's pregnancy, postpartum, perimenopause, menopause, all of a sudden we get to really start to reveal what's actually happening behind the scenes. And so we try to blame hormones for migraines and anxiety and insomnia, when in reality, a lot of times these women then just are given like more SSRIs, more hormones, and it doesn't fix the problem, because the problem is honestly usually coming from their gut, and it's coming from their immune system, and it's more of a total body histamine response. And this is signaling a nervousness and an agitation in the brain and the nervous system, but it's not all in your head. This is very much in your body. So in today's episode, I really want to zoom out. I want to put the head back on the body. And I want to talk about how the gut and the immune system interact with our brain and interact with our nervous system, and give you guys, like I said, just a completely different perspective to think about this neurological field than what we're hearing in like conventional medicine for sure, but also even from a functional medicine perspective. I just see so frequently where people are not interested in managing their health with prescription medications, which is great. I support that. But also then all they're doing is choosing like supplemental, like herbal supplemental ways of the same Band-Aid strategy. So they're like, I don't want SSRIs, I'm going to take saffron. I'm like, cool, that's fine. Or I'm going to take L-theanine and ashwagandha. And I'm like, no, that's great. But also like, what are we doing for the source of the anxiety? Because that's not doing anything for the source of the anxiety. Are we looking for why the body and the brain feels agitated, why it can't turn off? What is keeping the brain and the nervous system under these like kind of excitation type states? And more often, I'm seeing that there is very much a histamine correlation here that a lot of people are kind of missing. So just like we talked about with digestive symptoms, when someone presents with some of these neurological side effects like the migraines, anxiety, heart palpitations, brain fog, insomnia, I'm not just listening to whatever diagnosis that they've been given. I'm listening for patterns here, okay? So usually histamine doesn't just show up in like one isolated system. It shows up as a pattern across multiple systems. I'm going to keep getting those two words mixed up. For someone that comes in, let's say, for example, with like anxiety, and they are being medicated for anxiety, but they feel like their anti-anxiety medications are just like no longer really doing the trick. When I dig deeper, sometimes based off of the questions that I ask, it usually doesn't feel like purely psychological anxiety, which is why they're still struggling even with anti-anxiety medications on board, because their anxiety feels physical. Like I said, they feel like their heart races, they feel like they get flushed, they feel like they get sweaty, their chest feels like it gets tight, it comes on quickly, and then it kind of resolves like just as quickly. That's a clue, right? That is a clue to me that this is not just something that's like anxiety coming from like all in your head, right? This is very much a physical body telling the brain that there's something to be anxious about. What is it and why, right? Or maybe someone comes into clinic and they describe that they get a lot of migraines, they get a lot of cyclical headaches. Sometimes it's not even always connected to their menstrual cycle, but maybe it is for females, but maybe it's triggered by certain foods or alcohol or stress or like I said, hormonal shifts as well too. And sometimes these migraines are accompanied by nausea, light sensitivity, even dizziness. That's another clue, right? Like this is not just a migraine that's isolated to their head. This is something that's giving them a lot of total body symptoms as well too. Or even, like I said, someone that talks about sleep and insomnia. They're consistently waking up between 2 and 4 a.m. and they wake up and they feel like very alert. They feel like they can't settle themselves down. They might even wake up like in a night sweat kind of feel. They feel like wired at night, even though they're also internally exhausted. And then you start to layer in other symptoms too. They also have skin issues. They have chronic eczema. They have chronic seasonal allergies. They have digestive symptoms. They easily react to certain foods in their environment, certain chemicals in their environment. When you start to piece these things together, guys, like this is not just anxiety. Like this is not just migraines. This is not just insomnia. Like this is histamine driven nervous system activation. Okay. We can tell the brain to calm down all day long. We can do our breath work. We can do our meditations. We can do our yoga. I am full send support on all of those things. But that's not necessarily addressing why the gut and the immune system might be telling the nervous system that there's something to be stressed about. And unless we're going to come at it from, like I said, a total body perspective, some people just get left behind and they just keep getting new anti-anxiety medications, or it's let's layer this medication on top of this medication. And if their symptoms aren't just neurological, then we're probably going to miss the mark for these individuals. And to understand kind of why this happens, we have to zoom out and look at what histamine is actually doing to the nervous system, because histamine is not just an immune molecule. A lot of our histamine is made in the mast cells, and our mast cells are in the immune system, which 70% of the immune system is in the gut, but we have mast cells in all of our mucosal membranes. So even our throat and our lungs, even our vaginal canal, right? It's like our nasal passages, right? We have in all of our mucosal membranes, you have immune cells, and those immune cells have the ability to trigger more of a histamine type reaction. Histamines are also a neurotransmitter. So when histamine levels increase in the body, it generally influences the brain and a lot of the nervous system function. So the first thing that is always like a clinical clue to me is somebody's body that just feels like very easily agitated, right? And not agitated in a bad way, but more so histamine is what we call a neuroexcitation. So it excites the nervous system, and it's someone that like can't sit still very well, someone that feels like when they do try to sit still or like meditate or breath work, they feel very antsy, they feel very uncomfortable. Like I said, someone that has like a lot of issues falling asleep, staying asleep, because histamine in the brain promotes wakefulness and alertness. That's what it's going to do. Its role is to keep you awake, aware, and responsive to your overall environment. But when histamines become elevated, that stimulation can become over excessive, and then we can't shut that response off very well, and it shows up as anxiety, restlessness, racing thoughts, difficulty relaxing. We tell that person, why don't you just calm down? Have you tried some breath work? Have you tried some meditation? Have you tried journaling? And it's like all of those things are great, phenomenal, awesome. But also we need to start to think about like, why is their body producing an excessive excitation response when there's nothing seemingly in their environment that would be triggering that? The other thing, because of this neuroexcitation, histamine disrupts sleep-wake cycles like crazy. So we don't feel normal sleeping patterns. One of the reasons that people have one of the reasons why people with histamine issues also experience difficulty falling asleep. They wake up a lot in the middle of the night. They feel like they're a very light sleeper and like anything can kind of wake them up. They can't get into that deep restorative sleep pattern. And it kind of the classic clue for me here is, do they wake up sometime between 2 and 4 a.m.? Usually this is some sort of imbalance between the stimulation and regulation of the nervous system as well too. So it can also show up like histamine makes things very vasoconstrictive as well too, right? We're trying to get more blood flow to the brain. And so what you'll see is it controls heart rate, it controls blood pressure, it controls circulation. So if you have histamine issues, you also have heart palpitations, increased heart rate, fluctuations in blood pressure, dizziness, lightheadedness, which is why we'll talk about this as well too, but this is why some of those downstream diagnoses, like when someone has POTS, which is called postural orthostatic tachycardia syndrome, usually it's treated as a cardiovascular problem. This is a histamine problem. Or someone that is told they have dysautonomia, which is dysfunctions in regulating those subconscious patterns. We shouldn't have to think about our heart rate. We shouldn't have to think about our blood pressure. We don't have to think about our eyes like vasodilating. Our body does that just subconsciously in response to our environment. But for someone that is actively has histamine dysregulation, that is overactivating their nervous system, they get diagnosed with some of these dysautonomia type patterns, and it's a histamine thing. And it's like they get told to like calm down, regulate your nervous system, which I love. I just think that sometimes that is also a little bit of a gaslighting strategy for some of these individuals that are having gut immune mediated neurological patterns. You can't tell. Good luck, like tell the immune system, like calm down, it's okay, when it feels like there's this massive onslaught in the body every day. Not to mention that histamine and estrogen in the body have a bidirectional relationship. So it's like estrogen can stimulate histamine release and histamine can influence estrogen activity, which is why a lot of women notice increased anxiety, more frequent migraines, worsening sleep, especially at different stages of their cycle. Even situations like premenstrual dysphoric disorder or PMDD, that severe mood change that can happen in and around a woman's luteal phase, that is histamine driven, right? I've spoken about this before. It's just that we, in more of a conventional medicine, we love to like zoom in and like, it's a hormone problem. I'm like, is it hormones or is it the gut and immune system dictating what the hormones are doing? So you can come over here and you can play with the hormones all day long if you want to, and it's going to be like, like maybe a little bit of reprieve, but not a lot. Same thing with like the migraines and insomnia and brain fog and, anxiety. It's like we can take the head off the body and kind of spot treat it all day long with anti-anxiety medications and SSRIs and like treat it that way. But it's like, is the body telling the brain that there's something to be on guard about? That's a different story. Right? So this is why I just feel like we, in both a conventional medicine and honestly from a functional medicine perspective, I don't think that we're understanding this immunological landscape that is this post-COVID era, and individuals' immune systems are not okay. and because of this, we're treating and we're kind of missing the forest for the trees, in my opinion. So the conventional approach for a lot of these individuals with, like I said, these neurological and nervous system imbalances, whether you've been told you have migraines, you have anxiety, you have insomnia, you have POTS. It's like these are things that are seemingly just treated as separate conditions, right? Anxiety is treated with medications that alter your neurotransmitters, or migraines might be treated with medications that suppress your pain pathways, or heart palpitations are managed with beta blockers and cardiovascular medications, and sleep issues are treated with sedatives. It's like, I think if we stop just taking the head off the body and like tinkering with it and then putting it back on the same body, we would probably have much better approaches when we start to understand what is the body really communicating to the brain. But honestly, even in the functional medicine world, I'm also seeing people get duped because while they don't want to manage their neurological conditions with medications or pharmaceutical medications, I get it. That's like totally your prerogative. But then functional medicine is just telling them like, oh, you have cortisol issues. And it's like, well, yeah, I have cortisol issues. Like my adrenals would be fried too if my immune system is telling them that there's something to be stressed about every other second of the day. So they get put on like I said, your ashwagandha and your L-theanine and your holy basil and your saffron and all these things to like calm down, or like some adrenal glandulars. And it's like, those are great. Don't get me wrong. But what are we doing to actually address the source, right? Because all of those things are just more like kind of Band-Aid calming agents, which can be a very helpful bridge strategy, but that shouldn't be where the treatment stops. That should maybe just be where the treatment starts, just to give someone a little bit of some lifelines. But then we really need to go back to the table and really understand like, what is depleting cortisol? What is stressing out the adrenals? And that is when histamine is kind of left out of the conversation entirely, or honestly, when the gut and the immune system is left out of the mental health conversation, this is what happens, right? We start to just treat people with Band-Aid strategies. So in my brain, more of my practice and my holistic medicine methods to really restore this picture isn't just like focus on like, calm down, manage your stress. Here's some nervous system regulation tools. It is truly understanding that the neurological system is receiving inputs from the body. The current statistic is that the body communicates 80% to the brain, whereas the brain communicates 20% to the body. So why are we not looking at what the body is sending to the brain? So the question for treatment has to shift entirely. It's no longer like, how do I calm anxiety? How do we stop the migraines? It becomes, what is driving this nervous system state of constant stimulation? Like, that's what we need to go after. And I discussed some of these last week, but in this more like histamine dominant state, if that's truly what is driving this for some people, this is biochemically activated here. So, and it's not just one single trigger, it's usually some sort of combination of factors. There's either some nutrient deficiencies, some key cofactors that are missing for our body to be able to actually clear histamines like B6 and copper, vitamin C, magnesium deficiency. There could be some dysbiosis, too many bad guys in the gut that are actually producing endogenous histamines. There could be some toxicity concerns and exposure like mycotoxins or mold. There could be, yes, do parasites cause a histamine response? Yes. Does candida and yeast cause a histamine response? Yup. And then the nervous system might be amplifying or responding to that. I can tell you if your brain or if your body is telling your brain like, hey, you wouldn't guess what's going on down here, like SOS, of course you're going to feel anxiousness. Of course you're going to get migraines and brain fog and insomnia because your gut is constantly communicating to your brain like there is something to be stressed about down here, right? And this to me is why in this holistic medicine methods that I've developed, mental health is physical health and physical health is mental health. Like we don't tease those two apart. Like especially when I see some of these neurological conditions in my clinic, my first goal is what's going on in the gut, right? What's going on in the gut terrain so that histamine can turn itself off again and regulate that. And this is exactly the type of investigative work that we do inside my functional wellness consult. So if you're curious about this yourself, of really starting to understand like, what are the multifactorial things that are contributing to some of this like neurological symptoms? If you do put yourself in the bucket of like a chronic migraine sufferer, anxiety that is non-responsive to anxiety medications, or continuing to have to increase dose or layer in more anti-anxiety support, or feeling like your anxiety and migraines and insomnia is also coupled with skin issues and gut issues as well, and seasonal allergies, like there's probably something connected here. And we can dig into that with my functional wellness consult, where we can actually draw some comprehensive labs and get an opportunity to sit down and piece together your own kind of medical puzzle. I love being people's medical detective and starting to piece this out for you. So if you're interested in that, you can click the link in my bio. It will send you right to my calendar where you can snag us a day and a time to do that. And I will look forward to meeting some of you through that channel, or we will be back next week for even more talk around this histamine spectrum disorders, what I'm seeing in clinic, and some of the biggest pitfalls that we start to see in this picture. So enjoy your week, and we'll see you then.